Did you know 1 in 25 adults live with a serious mental illness, and there is no single cause for mental illness, but we do know help is available to you. And joining us now is Veronica Keith with Oceans Behavioral Hospital, IOP, here in Tupelo. How are you, Miss Veronica?
I'm great, thank you.
So tell us a little bit about Oceans Behavioral Hospital.
We have an inpatient and an outpatient program. Our inpatient program has 17 beds for adolescents and 17 for geriatrics. And so that would be adults 55 and older for our geriatrics, and then 12 to 17 for our adolescents. And then I'm the director of our outpatient program. We see the same age group, same population. Outpatient program is intensive outpatient. So they come a minimum of 3 days a week. We have group 5 days, but they come a minimum of 3. And it's 3 groups back to back. They are 45 minutes each. We do feed them a meal. So for our older adults that are there earlier in the day, we feed them lunch. We bring in lunch. They have snacks, coffee, drinks. Same thing for our adolescent program that's a little later in the afternoon. They come for several weeks, and they stay as long as we are charting that they continue to need treatment, and then once they have met the maximum benefit with us, we transition them into a lower level of care.
Now, when it comes to mental health, have you noticed an increase in the need for services?
Absolutely. It seems that with us, we stay pretty booked, but also when we're trying to transition patients, sometimes the next appointment that we can get them is several months out, and they're going to run out of medicine before then. So we have to start our transition program or our process immediately upon admission, so that we make sure that we can get them in appointments, because we also do medication management, and we have a nurse practitioner, and we have psychiatrists that are on board, and so in that process, you know, we make sure that we have follow-up appointments.
Okay, and when it comes to mental health problems, I would say, what are some of the problems that you're seeing right now?
A lot of depression and anxiety, some grief, a lot of trauma, but also substance use. We have co-occurring disorders where they come in and they're fighting battles with substance use, but also with anxiety or depression or grief. And, you know, every now and then we see some schizophrenia, schizoaffective, psychosis, things like that.
Okay, now you are hosting a mental health summer camp. Tell us a little bit about that.
This is our summer camp for the adolescents flyer. And like I said, we treat depression and mood disorders, anxiety disorders, trauma, psychosis, substance use, emotional regulation, and we treat more of it. These are our focuses for the summer, and it's broken down in 8 weeks. And each week has an ocean-themed label. And so this week we are in Happiness Comes in Waves, and we're just talking about coping skills and emotional regulation and how to cope with that, because, you know, every day is not going to be your best day. Happiness does come in waves, and just learning how to cope with that throughout the summer.
All right then. Well, thank you, Miss Veronica, for joining us this afternoon and telling us all about Oceans Behavioral.
Thank you.
You're welcome. Well, still